Drug-food interaction. We already learned about the type of drug-nutrient or food interaction. Now, we'll cover the influence of meal on drug absorption and group for close monitoring. Drug absorption. Drugs given intravenously are not expected to be influenced by food. Orally administered drug, if bioavailability is low, greater likelihood to be susceptible to effects of food. If bioavailability is high, for example, more than 90%, effects of food may not be significant. Bioavailability. Decreased bioavailability will cause therapeutic failure. Increased bioavailability will increase risk of toxicity. Influence of meal on drug absorption. Concurrent meal intake affecting drug absorption. Meal intake stimulate gastric secretion. Some drugs are not acid stable, so exposure to acid leads to chemical degradation. Others are dependent on acidity for good absorption. High-fat meal. High fat content stimulate release of bile salt. For example, increased absorption of lipophilic drug, antiretroviral drug like saquinavir. High fat content also release high concentration of cholecystokinin, so slow GI motility and increase contact time, therefore increase absorption. Some medication should be taken with food. Taken drug within 30 minutes of a meal can maximize drug absorption. For example, antibiotic, cefuroxime, erythromycin, and lovastatin, also lithium. Medication that should be taken with food for other reasons. Some medications are taken with meal to avoid stomach irritation. For example, non-steroidal anti-inflammatory drug. Anti-diabetic medication are taken before a meal to avoid the risk of significant hypoglycemia. Acarbose, which is one of the anti-diabetic drugs, blocks and delays digestion of CHO, carbohydrate. Therefore, the effect is maximal when taken with meal. Medication that should be taken on an empty stomach. So we take drug at least 1 hour before or 2 hours after a meal to maximize drug absorption, and also avoid physical interaction that can interfere with absorption process. For example, antibiotic like ampicillin, ciprofloxacin, doxycycline, tetracycline, and also captopril. So next, target group for close monitoring. Risk factor for adverse event associated with drug-food interaction. For example, patient with chronic disease, they use multiple drugs. Patient using drug with narrow therapeutic range, and also children. Elderly, have multiple disease, use multiple drugs. They also has reduced sense of taste and smell, chewing, swallowing, and gut motility. And elderly cause changes in pharmacokinetic also. Next, patient with impaired organ function. For example, patient with renal or liver impairment, including patient with GI tract dysfunction. Patient with impaired metabolism may be caused by their genetic. Patient with poor nutritional status, such as patient with cancer, and also patient receiving enteral nutrition.